people in now, so I'm going to make a start. So thank you so much, Pragati, for agreeing to do this. I know this is going to be a really, really amazing session. So Pragati, I'm just going to do it before I do Pragati's official bio. I'm going to do like a little bit of introduction for those that weren't here in the beginning or listening to me waffling on earlier, or those who are watching us on the recording. So a little while ago, I was asked to peer review an article, and it was the article that is linked to this research. And I thought this was a fantastic piece of work, so ambitious and had accomplished so much, and written from a methodological point of view. There's a lot of information in that paper, so I was really impressed with the from, you know, I suppose the rigor of the writing in getting everything and all of the thoughts and processes written down. Unfortunately, those of you who are long-time members of the Realist Hub will know that I developed COVID, or contracted COVID, and then was off for a long time with long COVID. So I never got to do the second round of peer reviewing, but I'm pleased to say the article is published. So that's all right, isn't it, Pragati? We got there in the end. But I remember reading it, and I think I sent a confidential note to the editor saying, I want you to present on the Realist Hub. And then obviously with the difference with me being off, it's taken a little while to get it all organised. But I'm so pleased that you're here today. And I'm really, from my point of view, from a selfish point of view, I'm really excited to see the paper come to life through your own experiences and through the way that you will narrate it. So anyway, we're going to get on to your biography. So Dr. Pragati Hebbar brings over a decade of interdisciplinary experience spanning research, policy engagement, program implementation, and capacity building. She trained as a dental surgeon with a PhD in public health from the Maastricht University, and her ongoing work through a DBT Wellcome Trust India Alliance Fellowship focuses on implementation research and realist research. Her interests lie in bridging research and practice, fostering compassionate leadership, and supporting institutional transformation. She's played a key role in co-developing and facilitating learning programs for mid-career professionals in public health. She engages with health systems actors across sectors and levels at district, state, and national levels, and is currently serving as the regional board member of the Health Systems Global for the Southeast Asia region. God, Pragati, what a bio. That's awesome. That is like something to aspire to. So someone I'd like to know more, I think. There's lots of other things there that tick my interests. But as we were already 10 minutes in, what I'm going to suggest is that we pass over to you and we start. So if people have any questions for Pragati as she's presenting, if you put them in the chat, and we'll come to you at the end, I think we could end up with the numbers that we've got today. I think we could end up with a really interesting discussion at the end, which I think will be a little bit more than the quick fire questions that we get, question answer normally. So over to you, Pragati, if you want to start sharing your slides. I'm really looking forward to it. And thank you to everyone who's coming.
Yeah, thanks a lot, Joe and Lauren, and to the Realist Hub for having me here today. I hope I'm audible and the sound is all right.
Yeah, it's much better than it was earlier. Yeah.
Yeah, great. And hello, everyone. And I thought that as we start, we could get to know a little bit about who's in the room. If you'll have your phones, or if not, if this link can be put up in the chat, it would be great if you could join into the slide deck just to get a little about who all is with us today. So I just pasted the link in the chat as well. So yeah, within the realist community, where do you see yourself? I see about 5 people have logged into the slides, 7. That's good. Yes. Great.
Pragati, I love it. Been there, done
that. Yeah. Nice. Okay. So we have fairly quite a few people who are just entering, exploring. So I think great, and I hope that This example just shows you how a realist piece looks in practice. So that's the whole point of it. So I'll move on then. Since we've all been working in public health or allied areas, would be good to just know a little bit on what is your main area of work currently. Is it any disease specific areas? Is it broader issues in public health? Anything on education? Yeah, great. NCDs, mental health, community health, early childhood development, cohort studies, antimicrobial resistance, health policy and systems research, oral health, policy implementation, policy evaluation. Great. Implementation research. So quite a diverse audience, even though we're quite a small group, but great to see the diversity in the areas that interest us. Wonderful. Funding, policy evaluation. Okay, yeah. And where are we right now? I mean, where are we working out of? Okay. And maybe another one or two. Yeah. So have you been part of any team that has conducted synthesis or an evaluation? Okay. Yeah. Good to see some amount of experience already. Yeah, in the room. You've actually done things, so that would really help with the discussion. I think looking forward to the segment. And lastly, for the ones who answered yes or who have been part of realist evaluations or realist synthesis, which or what basically policy areas or programs have you evaluated? CD services, great. Stewardship, antimicrobial resistance containment programs, okay. Men's health, disability policy, mental health, stroke services, medication optimization, individualized funding, community interventions, NCD services and antipsychotics. Great, again, quite a few different areas. Just see someone typing, so maybe just another second. Parenting programs. Okay, shared decision making. Wonderful. I think that's quite some diversity that we have in experience. So great. I think that just gives us an idea. Exercise programs. Okay. Yeah, physical activity, I guess. Or so then let me get to my other deck, which I had planned to share today. Okay, and I hope it's all right. It's come up in the slideshow view. So great. So thanks a lot for engaging. Firstly, thanks a lot for joining this conversation today. And it was great to get a sense of all the realist and policy evaluation work that's ongoing in different parts of the world. And today, I think my focus is on one such issue, which is of tobacco control and very relevant for policymakers, implementers per se in our setting, where they're trying to strengthen existing programs. So I'll dive right into why the the case of tobacco firstly. So I mean, there is a global burden, not to take that away, but the hardest is in the LMICs, where a lot of the smoking related deaths, as well as those due to secondhand smoke, uh, occur. And this has been sort of measured, documented. There's enough and more scientific evidence on the prevalence, usage, etc. So, with that, there was the World Health Organization's Framework Convention for Tobacco Control, or FCTC, and many other countries also have their own national policies, either aligning to the FCTC or building further on the FCTC. But still, the implementation of all of these remains highly variable. So, that is the core problem here, that even in India, as I share in the next slides, there are quite a few policy approaches, but the implementation has been extremely varying. And another issue that is there is the lack of theorization. So there are a lot of trends that are captured through the large surveys, but there are not adequate explanations, problematization, or theorization of how and why these policies are working or failing, especially in LMIC settings. So now zooming in a bit on India specifically, the usage burden is huge. So we have almost 267 million adults who use tobacco in one or the other form. And in India, the tobacco usage has myriad varieties. So there are various forms of smoking tobacco, but there are also a lot of smokeless tobacco forms that are available in the market. And this poses a huge economic burden of almost 1.04% of our GDP. And the prevalence in India across the Indian states ranges right from as low as 9.7 to as high as 64.5% of some state populations that use tobacco. And what I'm depicting here is the implementation of the National Act, which is to prevent cigarettes and other tobacco products. And the states that are in green, they show an improvement of implementation over two survey rounds, whereas those which are in blue are sort of stagnated or average, and those in shades of orange and red are the ones where implementation outcomes have actually worsened. And how did we measure this? So this was mainly through proxy indicators of implementation, and I'll explain that in the coming slide. So, with that huge burden that exists, we would now like to see what has been the policy response for that. So, from early 1900s, there has been growing evidence of how tobacco has a role in causing cancer, especially a lot of large cohort studies in India as well. And quite late in the day, so in 1975, we had the Cigarettes Act, which was relatively weak and in its constitution, but also in its implementation. And a decade later, the process for developing a more comprehensive legislation was started. And this took another quite a few years. And finally, in 2003, after multiple rounds of consultations across ministries, across civil society, and other actors, the enactment of the Cigarettes and Other Tobacco Products Act, or COTPA, as it's called for short, was undertaken. in the similar time frame globally also there was a lot of action happening on tobacco control. So there were interministerial, inter-country sort of consultations by WHO to develop the FCTC and to get it ratified by countries. And India was one of the early signatories of the FCTC as well. And lastly, in 2007-8, a national tobacco control program was launched. And this program mainly supported the implementation of the COTPA Act. So briefly about COTPA and NTCP. In COTPA, there are about 33 provisions, but the main enforceable ones are 4 sections. So the section 4 is on prohibiting smoking in public places. Section 5 is on prohibiting direct advertisements like the one that you see. Section 6 is on restricting access to minors. And Section 7 is on having pictorial warnings on the tobacco products. And the National Tobacco Control Program was a three-tiered sort of a program where there was a district level, where there is a set of human resources available, there is reporting structures, and then there are state tobacco control cells for each of the 36 states, and then there is a national level tobacco control cell. So this harmonized the reporting of tobacco use and its implementation, as well as created dedicated funding and human resources to implement the provisions of COTPA. So, given the complex nature of the issue under study, which is tobacco control having a multitude of stakeholders, and the complexity of the program and the policy itself, we chose the realist method. And the other issue was also on the variability of implementation, the same law which is applicable across the country, and to see such diversity, we felt that through realist methods, we might be able to unpack explanations with a bit more depth. So we followed a realist synthesis, which we initiated with, and then that was followed by a realist evaluation. So we used like a sequential method of the two inquiries. Theory development and the entire study design. And for those of you familiar with the realist inquiries, you would have seen the cycle multiple times. So there was also an attempt to initially start off with the implementation research, framing and understanding of policy implementation. So a lot of our initial theory gleaning leaned in on many of the implementation science and implementation research frameworks and theories. So things like the Combi model, there was a conceptual model on diffusion of innovations, the active implementation frameworks, and a couple of models which were specific to tobacco control as well. So I'll briefly skim through these and explain why we thought of those. So mainly there are officials, or if you think of them as street level bureaucrats, the implementers on ground who have a variety of capability, opportunity, motivation for them to implement the laws. And looking at it from their perspective, these constructs were sort of kept in mind and found to be relevant to understand their behavior. This model by of diffusion of innovations in service organizations by Trisha Greenhalgh is another space where a lot of the inner setting, the outer context, the innovation itself, the implementation process for that innovation, the adoption of the innovation. So many of these constructs that were within this framework were also found to be useful in our setting, where especially those for the implementation process, things related to decision making, to the kind of dedicated resources required, collaborations, feedback or monitoring of progress, etc. The active implementation framework was another framework that helped us look at the process of implementation, mainly on how there are different stages after an innovation comes into being, or a policy or a program, there are multiple stages, things like the early initial implementation, followed by the full implementation, and what are the drivers that help promote or support the implementation process, followed by cycles of learning, doing, and studying and analyzing them. So, some constructs of this framework were also found to be useful for our case. This was a tobacco specific framework by the International Tobacco Control Policy Evaluation Project, where they spoke about moderators or somewhat things within the background, things like the country demographics, the individual characteristics, etc. And then there is a policy. What are the kind of variables that the policy demands of on awareness related to tobacco products, on quitting cigarettes, etc. And what are the individual level psychosocial mediators, things like their own beliefs, the perceived risk, the normalization of beliefs, and finally, what are the outcomes? So, do they do quit attempts? Do they go towards brand switching, etc.? And what is the impact of this? And lastly, one framework on implementation fidelity by Connie Ho. So here, this was a very specific one to tobacco control in LMICs. And the framework or the components that they suggested was on political commitment. So what is the political landscape at that point? What is the institutional capacity and effectiveness? What is the social climate? So, are there civil society organizations, advocacy groups, others? And finally, how does the tobacco industry interference play into the entire implementation? And at this point, just before this publication, like at that point, I was almost sort of swimming through a lot of mid-range theories or established implementation research frameworks. But I was not finding anything very specific and something that helps explain tobacco control per se. And just at that time, even this framework was published, and it helped me pause my theory gleaning phase basically. Otherwise, that was quite an elongated phase to just finally feel confident that you have seen enough and you've got a good understanding of available literature and frameworks. So, as a PhD student, I think that's one constant choice that one needs to make on the amount of time available and how much you can sort of engage in each of the phases. So this was one of a prolonged phase for me. And finally, with this framework, I then just put my thoughts down as a rough program theory that at least the things that we are seeing are that these are not specifically mechanisms or anything close to that. It was more of a line list of factors that were there at the macro level, at the meso level, and the micro level. And in fact, this is not in the published literature also. It's basically just a very rough framing that I wanted to see factors that affect implementation at these three levels and to explain what makes them either improve or stagnate or decline. And from there, then we move to the CMO sort of a framing. So this was the initial program theory where through informal interactions with the national and state level experts of tobacco control, also program documents of the COTPA as well as the National Tobacco Control Program and several other related operational guidelines on how the law and act need to be implemented. So all of these were studied. And lastly, me and a couple of members on my advisory team had over a decade or more of tobacco control experience. So putting all of that together, we developed this initial program theory where we put down factors at micro level, at meso or interpersonal level, things like role clarity, the interdepartmental coordination, and at the macro level, just the cultural acceptance of tobacco. And in India, there are a few states where they grow tobacco, large quantities of tobacco, and some states are non-tobacco growing as well. And the amount of industry interference that happens. And we put the mechanisms into three strategies. So one broad strategy was on education or awareness. What we mean by that is that the officials who need to implement the act, what is the level of their awareness, and also the level of awareness among the public per se. The second strategy was on enforcement machinery, and the third was on regular monitoring or review mechanisms. And this was where we initially started. So in this realist synthesis, basically we went through about 19 days databases, and we had over 2,651 articles, and finally about 47 were selected based on the inclusion exclusion criteria. And I'll just take you through some of the mechanisms that we then found, and this was then later published in BMJ Global Health. So we used Posson et al.'s 5 steps. Firstly, for clarifying the scope, where we went through that entire theory gleaning phase and developed our initial program theory, and then we did the searches, and we there were two of us who did sort of detailed coding, appraisal, extraction of data, and finally we went into the synthesis. And during the synthesis phase, we also utilized the opportunity of some workshops with people who are within the realist space, within our networks, and try to help with the sense making. And ultimately, it also further followed dissemination to the policy audiences. So, mainly what we try to include as within the study were things that explained some of these three strategies, things that had facilitators barriers, basically articles that went beyond just numbers or quantifying implementation, where they were able to provide more explanators. A lot of the exclusion criteria were focused mainly on articles. When we ran searches also, there were lesser articles in the policy implementation phases. There were a lot more in the development and other phases of the policy cycle. And there were some more theoretical or conceptual. And lastly, there were many on the disease focused. So things on cancer, things on cardiovascular disease, etc. So these 47 articles, a large majority of them, 29 were published post 2016, and about 17 of them focused on tobacco policies, control policies in general. 11 of them were on FCTC implementation per se, and fewer were on smoke-free regulations, on cessation practices, on tobacco advertising, promotion and sponsorships, and on smokeless tobacco. And we followed the steps of scoring for relevance, for rigour. And since both of us did it independently, there were these reflective conversations at the end of each article to sort of synthesize our understanding across the two reviewers. And finally, we had those set of workshops where we were able to uh, make a bit more sense. So the 30 mechanisms that you all saw, so there are, I mean, I'll not go through each of them for the interest of time, but sharing a few, for example, like in the awareness, um, the the thing about normalization of tobacco use. So within societies, within families, within the neighborhoods, this really led to reducing the compliance by vendors. So because it was so acceptable for people to use tobacco, so even if minors went and purchased tobaccos, the vendors didn't really stop or question or ask for an ID because it was a practiced norm. And if I look at some of the positives, then things like increased readiness of the whole of the organization through champions. So when these implementers or enforcers are, some of them take on the role of champions, they are able to pool resources better, they are able to make more connections across the system, and that then improves the sustainability of the program. So it does not always need an external training or an awareness component. If and the box below is collating all the contextual factors that interact with the awareness strategy. Moving on to enforcement. So some of if I look at the initial ones, so the since I mean, if when there was no fear amongst the public, when the enforcement was not very visible to them, uh, then they were easily flouting smoke-free norms, especially, and even the low fines did not deter them usually, and so that deterrence, the fear, etc., was not there, which led to a lot of flouting of norms. Whereas in spaces where civil societies were very active, they were able to support and mobilize enforcement. So enforcement was such a space where many a times there would be the policy itself mandated a complex process of a interdepartmental squad, and if that interdepartmental coordination didn't happen, uh, enforcement efforts would also stall quite a few months to years. And whenever there was an active civil society organization or participation, nudging, supporting such efforts, uh, we could see that those states or those jurisdictions could move things better. Coming to the third strategy of intersectoral coordination. So here, when multiple departments need to work together, there were quite a few mechanisms which were getting triggered. Things like friction due to mistrust, departments that have not worked together before, confusion, or in some cases, there was also lack of motivation and empowerment. Whereas when they came together with clarity and they came with a sort of a combined purpose, there they were able to form a sort of group identity, and that helped them to continue and have better implementation. And lastly, on the fourth strategy of tobacco industry interference, there is a lot and more on the various tactics that tobacco industry uses. So be it on intimidation through legal routes, diversification of products, etc. So many of those also we found within several countries. And lastly, on a positive front, whenever there was vigilant civil society, which were exposing these sort of industry interference linkages, that was helping to counter the industry interference challenges. So, to sort of synthesize further at which levels these strategies were working, we developed this a simplified diagram basically, that at the individual level or the micro level, the strategy of awareness and many of the mechanisms that were triggered there was working. At the meso or interpersonal level, where a lot of it required coordination across people, across sectors, the mechanisms of intersectoral coordination and enforcement were working. And at the macro level, the tobacco industry interference, right from changing societal perceptions to policies, etc., was more at the macro or the institutional or infrastructural level. And the box on review mechanisms, which was part of our initial program theory, was actually not very widely supported in the literature, but more so only in the Southeast Asian countries. There was some support for the review systems. So with that, what we did was we moved to a realist evaluation. And for this evaluation, we conducted 48 in-depth interviews and about 100 non-participant observations. And lastly, we ended with 8 focus group discussions. So the 48 in-depth interviews and observations were done at 3 states, and we selected these 3 states purposively based on the Global Adult Tobacco Survey data, where one of them was the one that was shaded in green, the other was in blue, and the other one was in red. So we wanted to have diverse cases which could bring out the nuances of implementation. So these are just some images from the field where things about public smoking, things about access, how easily within, say, the bus stops, etc., the availability of tobacco products was there. And this display, which is mandated by the law, was usually found at a non-functional or a locked gate and not usually present at the main entrances where it needs to be there. And things like in many of the Western countries, there's this power wall where they stack up tobacco, and that serves as an advertisement. So a regional variant of this is where the just the sachets of chewing tobacco, and people know that that shop is where you will get the tobacco, and that itself acts as an advertising. Here too, the honey dew sort of pattern is these boards are also usually sponsored by tobacco industry, and that is an attempt at stretching the brand. And the other provision on minor usage of tobacco. So again, this was quite common in 2 of the 3 states that we conducted observations in. And the last provision of pictorial health warnings, again, this was also flouted quite regularly in international brands as well as in BDs, which are the Indianized versions of cigarettes, which is actually rolled dried tobacco using a leaf called tendu leaf. So these products also usually do not contain those pictorial warnings. So these are just some glimpses from the field. So compared to the previous version of, we started with that as our initial program theory for the um, realist evaluation. And the font in blue is all the changes that you see through the realist evaluation interviews as well as observations. So some of the major changes was mainly at the interpersonal level, where a lot more detailing into the monitoring mechanisms, the reporting and coordination across systems, etc. And at the macro level, where there was easy affordability of the products, accessibility was extremely, in some of our settings it was difficult for us to find a bottle of water, but tobacco was definitely available in most of the shops. So that was the kind of access that was there. When we moved to our mechanisms, we had 3 strategies initially, which was an awareness, enforcement, and review systems. But now, through the evaluation, we added a segment on intersectoral coordination and tobacco industry interference. And even in our outcomes, instead of just the improved, non-moving, and declining, we were able to explain that a bit more in detail. What does that look like? Um, with that program theory, what refined program theory, we went out to test this across Indian states, because the diversity is also too much in India. So our selected states were Kerala at the bottom, and West Bengal, and Arunachal Pradesh, which is right here at the corner. And we did these 8 focus group discussions across all of these states that have been colored. So the first regional consultation was held virtually because it was in between COVID, and the second one was then conducted in person. And through that, we then moved to our second refinement. And it is usually not the case where we move from, if we start with one type of a configuration, which is CMO or ICAMO or SCMO, any of the variations, we usually keep building up on that. But in our case, and even in the realist evaluation paper, we shared the justification because there was these diverse set of actors that had different mechanisms triggering for them. We then moved for the final iteration into an ICAMO version, which is a departure from the CMO that we had initially started with. So the interventions under study were COTPA and NTCP. In the context, there were several things which included things like infrastructure. There were active institutions or systems which were in place. There was existing trust, rapport within the stakeholders, and also trained human resources. But also in the barriers, there was extremely high acceptance and accessibility. The penalties were really low or not upgraded over many years. And in some settings, the industry interference was quite immense. So with that, we broke it down for four set of actors. So the first one was civil society organizations. So here we saw the mechanisms of collective action. So they were the ones that were able to fill the gaps across different departments which needed to converge or to undertake intersectoral action. And the second was for the law enforcers themselves. So the mechanism of felt accountability. So in many settings where there was a robust monitoring and review system, and the officials felt accountable, they were able to systematically conduct the activities. But wherever these systems were a little lax, the enforcement was also very sporadic. For the public, one of the major mechanisms was of fear. So, in some of the states, study states like the Kerala state, the enforcement was so visible that the vendors themselves would comply heavily with the provisions, and they would not let the public smoke in and around the public spaces within their vicinity. Whereas in many other states where this mechanism of fear for the public was not triggered, the enforcement was not visible, the fines were not a deterrent, there was non-compliance by the public as well as the vendors. And lastly, by for the policymakers. So for the policymakers, it is a matter of prioritization. So with the several things that are there on their table, uh, how and when prioritization of tobacco control takes place was mainly the conversation. And if it got prioritized, they were immediately able to locate resources, they were able to do a lot of activities. And if it did not come up on their priority, for example, in some states, they had international borders, they had other issues, they had safety or law and order issues, in which case tobacco never made it to the forefront or a priority. In those spaces, the implementation, the coordination, etc., was quite poor. So we ended with some thick descriptions for each of the state. So I'll maybe not read them through, but I'll leave it for each of the state for a few seconds for you all to quickly glance through. So the passage tries to capture the contextual factors, mechanisms, and the kind of outcomes. In Kerala, it was mainly about collective action across a diverse set of actors. In the state of West Bengal, the context was quite varied. The usage, the kind of products, the amount of social acceptance, the family structures, all of that. And here it was a bit more on the officials and how they were able to sort of do their duty accountably, and also amongst the public, the lack of fear, which led to a lot of flouting of the tobacco control laws. And in the third state of Arunachal Pradesh, where again it was a society with very high acceptance, but also a lot of illicit trade across the border, and the being one of the northeastern states, a lot of there's a history of reliance on the central government for a lot of support systems, etc. So that mixed with these competing interests, tobacco control could not become so much of a priority. And the usage was so extensive and socially accepted that people really didn't find it as a problem. And hence, that is the third kind of passage or a theory that we propose to explain the situation in Arunachal. Um, so yeah, so if I were to kind of zoom out and think of a few reflections, so being from India, and within the team, fortunately, we did have, being a PhD endeavor, there were supervisors, there were mentors, and fortunately, even through the broader funding by DBT Wellcome Trust India Alliance, where this project was supported for over 5 years, um, that provided access to research expertise. Otherwise, when we started the realist synthesis, for example, there was no realist studies on tobacco control by then. And only when we were kind of developing our protocol, there was one publication of a realist synthesis on smoke-free provisions. And he was also the jury, one of the jury members in my PhD defense later. So, so that was the kind of sparse amount of literature or resources that were available at that point in time. So if people are undertaking realist inquiries, uh, one of the fundamental thing would be to ensure that the team beyond you has good expertise or access to opportunities. Second is within the PhD, you and even other project frameworks, you have a fixed time and scope. So to keep the scope of your research study realistic and pragmatic is very important, because like I said, just the initial phase, and that too at the starting time when the capacity was also not that much, it does take quite some time to get into that, to get a hang of how to do things. So to also have the research scope managed in that way. So one of the initial decisions that I took, for example, in this tobacco control study was the stakeholder focus. For me, the actor focus was mainly the implementers, enforcers, etc. And hence all the interviews, all the observations were also tailored in that way. Even the focus group discussions for people who are in the implementation space, and not so much the end users or the public at large on whom the policy is being implemented. That would be the scope for another inquiry potentially. And lastly, I think it's about just setting expectations right, because just the our catch-all phrase of what works for whom, in what circumstances, that itself for many would raise expectations immensely. That, oh, we are going to provide magical solutions or answers to very difficult, very complex questions. So to also have especially with your group. So if it is the policymakers, if it is the implementers, to have those conversations and ensure that you are helping them with some of the questions that even they have, and how to make it policy relevant. For example, yes, just yesterday we had an event where a toolkit on enforcement was launched, and I'm really glad that a lot of it was also based and supported from that enforcement related mechanisms, because initially one would feel that theorizing versus policy implementation feels really disconnected. but to see actual tangible toolkits or products like that come out from such research is also quite encouraging. And even for researchers ourselves, I think as PhD students, when we are, all bright-eyed and we want to change the world with 4 years, 3 years of our research, I think setting our own expectations right with what and how much we can achieve with this piece of research was something that I also reflected as part of this process. So yeah, this is just the cover of my thesis, and it was basically on the implementation of tobacco control policies, the realist evaluation piece. So thank you for your patient hearing, and I look forward to engaging with you all on questions, thoughts, inputs from your experience of conducting research, especially with policymakers and implementers.
Pragati, that was amazing. Thank you so much. I still can't believe that was one PhD. And you talk about managing, expectations and of yourself, but that was one huge undertaking. And like I said before we started, I hope you're really proud of the work that you've done. So in true Realist Hub style, I like to put our cameras on at the end and offer a little bit of applause for our speaker, because if we were in the same room together, we would certainly be doing that. I have come to the very sad realization that some of you will use the visual clapping hands and will not actually turn your mics on and clap your hands, but those that do feel that you can, let's give Pragati a round of applause for her fantastic presentation. So thank you very much. Okay, we've got a couple of people who are feeling brave. Well done, thank you. So if you've got any questions about this, I mean, there's so many things. My brain was spiring off in so many different angles. And obviously, I've even read the paper from the RE and consulted the RS one whilst I was peer reviewing that. And I still have loads. And from a methodological point of view, I think there are quite a few. So I'm going to ask the first question while the people are thinking about this to put in the chat. But what I was trying to think about was, oh gosh, there's so many different things. You would have had some ideas about, I'm guessing, about tobacco policy before you started this. Is there anything that has surprised you in the research? Because I know whenever I've started something and I think this is what it's like, there's something comes in from left field and you go, oh, I hadn't even considered that was a factor. And I always find those quite interesting, because that rigorous approach to the research and the realist way of asking the questions about the how and the why quite often surface things that you just hadn't even thought of. I mean, you've got such varying contexts and such varying outcomes as well. So anyway, before I kind of just waffle on about your project, I thought I'd let you know from you, did you get any shockers?
So I think shockers in terms of, yeah, there were states where the prevalence, the social acceptance is so much, but still they were doing well. I mean, once we started looking at the data more closely, just the initial thought of some contextual factors leading to some outcomes, just naturally, I think those started getting challenged there. Even the map that I showed up front when we are going into state selections, although having worked in the field for some time, some of the states, especially when we analyze the trend between the two rounds, it was quite surprising to see those states doing well, whereas the ones that are usually presented as case studies, some of those not showing up in the list. So for me, the state selection component of just trends versus the other factors, that was a shocker. In terms of expanding, so in our setting, review mechanisms was is something that really nudges enforcement. And to not see that in the realist synthesis across where we did it across LMICs, that was another shocker that, oh, it's only in our settings, maybe that there is the need for that much of reviewing and monitoring. That was another, yeah.
It's interesting, isn't it, how these things come up to us. Oh, okay, I didn't realize that was quite a play. I remember in my PhD, it was something really mundane that was really, really important, and it was how they organized their day. It's literally how they planned how they were going to deliver their therapy sessions. That was one of the most central things that underpinned their success. And it wasn't even on the radar. There's not even any literature about it. So, you know, those are the kind of things I think that um, can really make you think and view things differently. And I think that's the beauty about the realist approach, is that it does, because you're asking these how and why questions all the time, it does make you see things slightly differently. I think I have another question, which is around I've probably got 80 questions. So please put your questions in the chat. Otherwise, you're going to get very bored of me asking Pragati my own personal questions. But it's around your stakeholder engagement, and you had quite varied stakeholders. And usually, when I'm speaking with people at the very beginning, I will advise them to do what you did, which is to have some quite influential people in their stakeholder group. Because if the aim is to do something high level, get something into guidelines, change policy, change practice, you need to have those people involved from the beginning. So I'm just saying that's not a question for you. I'm just saying that's one of the things I advise. But how did you manage that? Having worked with stakeholders before, they can have their own agenda, they can be guarded, they can be nervous, they can be very skeptical about the work that you're doing, they cannot turn up because they're too busy. You know, how did you manage all of that with the realist approach, you know, incorporating that into the rigorous, you know, iterative feedback loops that you have? So I do guess it's just your experiences of, you know, from a methodological point of view, about that varied group of stakeholders that you did have across the three. You call them states, not provinces. That's right. Yeah. Yeah.
Thanks. Yeah.
Yeah.
Yeah. Yeah, no, great question. So I think to start with, like you said, from the question phase, we were engaging with national level stakeholders, mainly to ensure that our inquiry later helps them in one or the other way, and that is that national or high level buy-in. When it comes to these states, I think to complicate matters, COVID, it was in between
Yeah.
COVID when my data collection was, due. But we went online, and to my surprise, I mean, initially I was not sure how they would do online, and would they, be um, just a kind of engagement, because we were just so much thinking that it has to be in person. But in fact, they did really well online somehow. And the initial one state, I had to do it almost online, and the next two states we did the visits, and
Yeah.
and we also did a follow-up visit to the first states, just to after the restrictions were relaxed of COVID. And so I these are quite diverse. What I would say is that at the district level, there was a lot more, which is sub-national. So there was a lot more openness amongst the stakeholders to engage, to be heard, because they would usually not find those spaces to articulate their challenges. So rather than being seen as being scrutinized or being evaluated, they looked at it as an opportunity to share their challenges. They were like, okay, if anybody's listening, what's not working, then here it is. And, they were quite open. A lot of these scheduling access issues were at the state level, where, yeah, it's the permissions, it's being there at the right time, and then finding that time and space. But maybe it is the long years of work and the familiarity of being within the field, that they were also able to connect the dots, and they did make time for most of the interactions. So, yeah.
That's really good. I mean, it's as you know, I thought it was a fascinating study when I was reading it, because we've had that discussion a few times. I'm sure we could talk all day about it. I can't believe you've packed all that in to a standard 3-year PhD. It's a phenomenal amount of work, a crazy amount of work. Anyway, we have a question, I hope, in the chat from Eunice. You're still on, you're on mute, you're off mute.
Oh, yeah. Hi.
Hello, nice
Thank
to
you so
meet
much.
you.
Hi, nice to meet you all. This is actually my first interaction with this group, but
Oh,
I
welcome
know
then. Welcome.
Pragati.
Hope we see you again. Although
Yes,
I
yes,
do
I'm looking
appreciate
forward.
that sometimes the timings are not great, but we do, that's why I record everything. So if the
Yeah,
timing doesn't work for you, check the recording out later. And I do vary it. So if anyone else from India wants to come, we do vary the timing according to where someone's speaking from. I don't think it's fair to ask people to speak in the middle of the night.
yeah, I think that's a great idea, because I actually had a conflict, but I prefer to come to this meeting. I just want to start off by saying that I already know Pragati. I've already heard this presentation about 3 years back during our defense, but it makes a lot more sense to me now, because I've been working with Dr. Prashant on the, realist work. getting back to the question about expertise, Pragati, you mentioned that there was no realist work done on tobacco control, but you already had a background in dental education. So, how important do you think your background as a dentist was to take up this work? And will it work for somebody who wants to venture into a new territory where they don't have the expertise that you had being a dentist and then working into tobacco control?
Thanks, Eunice. Uh, yeah, I think it definitely makes a difference because this was also one of the questions that my India Alliance jury had posed to me, that you've already worked in supporting implementation, tobacco control, and oral cancer and other spaces. So how will that impact or influence your study and your lens? And I think even the committee saw it positively. They said that rather than someone coming in without that methodological know-how and topical know-how, it's rather better to have the depth of either one. Both is good, but at least definitely one of the two. So in my case, I think all of that exposure of my dental background, of having worked on tobacco control from a different lens, was quite helpful in engaging with the stakeholders and especially in the interviews and the focus group discussions. Yeah.
I think I would agree with that. It's not impossible, Eunice. It just means that you have a steeper hill to climb because you're starting from the bottom. So after my PhD, I'm a stroke researcher. I spent 12 years in stroke, and I wanted to work on a realist review. So I jumped ship temporarily, like there's a big temporarily, from stroke to mental health for 12 months to work with Jeff Wong and Ian Maidment on a realist review because I wanted to do a proper realist review. I never went back to stroke. I really enjoyed mental health, and as a psychologist, I felt like I was getting back to my roots. But what helped there was that I already had significant realist expertise, but I knew nothing about the field, and it was pharmacology, so I'm not a pharmacist. So at least the realist thing gave me capacity to learn the literature, but it's not impossible. It really isn't impossible. You just need longer. And if you're doing it as part of a PhD, it's managing your own expectations. And then I would say it's really important that you surround yourself with a team that does understand realist work, because it doesn't need to be difficult, it doesn't need to be complicated, but people who don't understand realist work and come at it from a traditional review approach, like a systematic review or the randomized control trials, try and steer you down pathways that are not congruous to realist work, so they're unhelpful and can actually prolong your journey. So if you are starting from zero on everything, make sure you've got people in your corner that can help you work out how to push back against the you need to do this, you need to do that, when actually it's not a helpful thing to do. But yeah, I would say I think it's helpful to have something. It's less stress, isn't it? Doing a PhD is stressful in itself, but I think it's less stress if you've got a bit of knowledge, but it's not impossible. It's just you're in for a tougher journey. I think that's it. And I do a lot of support in that way with people. And sometimes it's just confidence as well, I think. And I don't know, Pragati, do you just see your whole life now as a realist, outside of work? I see my life in CMO configurations now.
Yes, yeah, and you'll find Prashant. I see my colleague Prashant here. Prashant and me making some of really bad realist joke sometime or the other in other meetings. So yeah, so I think it's a way of thinking. It's a way of
Yeah, it
looking.
is. And it changes,
And
doesn't it? It changes how you view
yes,
everything. You're always thinking of the so what. So why is that happening? Or why did that come to be?
yes.
And then I put it together in a CMO in my head and think, oh, that's a bit too much. I think that's a bit too much.
Just this morning, Prashant had one more program theory in another meeting of ours. So
I'm sure we could
yeah,
develop a program theory about today.
yes. And just another thing is that maybe, for example, my co-researcher in the synthesis especially was completely out of tobacco. And I had already been in tobacco control, oral health, dental health for a decade or more. And it did bring fresh perspective. So some
Yeah.
things that we had sort of just taken as the norm, he would challenge some of the basics. He would be like, okay, but why that? And how? And then I would be like, oh, yes. And now I need to articulate something that I just knew or just sort of understood. So I think it has its pros and cons. But yeah, like Joe said, it's about conserving energies and how much you have, and then going up the hill.
Yeah, I agree with that, Pragati, because actually when in our mental health stuff, I brought things across from the stroke world and said, actually, I have some insights here from my previous life that I think might be relevant. So I think it's just if you're starting from this base of zero, you probably won't be able to achieve what Pragati has achieved in her PhD, because it's phenomenal the amount of work that she's done, because you're starting from a lower base, because you've got to get to know the actual field first. So it's about managing those expectations and working out, if it's a PhD, what is considered enough for your institution, and then you work to fill that gap. But there's more and more coming out in terms of methodological papers to help guide you as well, which I think is also helpful. So and there's more resources like this, that you can go back and look at. So if it's on your radar, come back. The YouTube channel, maybe Lauren could put a link to that. It's ever so easy. You just put Realist Hub YouTube into the search engine and it comes up. But all of the previous seminars are all recorded and on there, and you can watch them at double speed. I'm sure I must sound ridiculous at double speed, but it means you can watch them a bit quicker and pause them and go back to the more complicated things as well. So anyway, so we've got Prashant here. Do you want to come on and join the conversation, Prashant? Otherwise, I feel like I'm dominating. And you've probably already all picked up my love for this project anyway, which started a while ago. So yeah, do you want to come on and join the conversation? I think some extra voices or some different voices, some more diverse voices would be helpful.
No, for me, I think the point you were making earlier about it becoming a bit all-pervading, like for example, like I think Pragati was alluding today, we had something else on a institutional initiative, and I keep thinking, oh, is what kind of mechanisms could this trigger among people? And
Yeah.
and you're always looking at different possibilities. You're looking also at different kinds of people having different ways of looking at a given initiative of our own. And I think what I really like is it makes you so much aware of our own diversity. The fact that even in a family, in a relatively small institute like ours, there is scope that the method allows to think about different ways in which the same initiative can be perceived. So yes, for me, it's entered into all aspects of life, far beyond the research.
Yeah. Quite surprising what it can do. I mean, Pragati, I have so many other questions, and I know, so you did the realist synthesis and then went on to do the realist evaluation, which I know we've discussed is challenging sometimes to do. How did you work out which bits of the realist synthesis to take forward? Did you take everything forward? Did you have to drop anything? Which bits became your priority? And which bits did you decide that you wanted to expand? And how did you do that, from a methodological point of view?
Yeah, I think from the synthesis, like I said, one of the strategies just getting dropped out, another new strategy coming up, and all the mechanisms associated with that. So it did pave the way quite well for our evaluation. And within the evaluation, then I wanted to kind of look at why some of those especially work across the three settings. And for us, these were like the complete, very diverse options. So Kerala was the best case scenario. West Bengal, Arunachal were really sort of struggling with multiple other contextual issues. So one attempt that we did, especially the focus group discussions, was something that we thought that uh, have we gone too micro into just these state specificities, and hence we said that we need to abstract out again, so that last refinement that you saw, that was when stakeholders across India and across departments. So those 55 people included people from health, from police, from education, from food safety, just all the allied departments that need to. And when they were looking at these formulations and these explanations and the conversations that we are having, then we were able to abstract out to those four stakeholder categories. So it was a bit like a back and forth. So the first scope was all of LMICs. Then we narrowed down to three specific states, and then we felt that that's becoming too micro. So the boxes that you see of each of the states,
Yeah.
that was very specific to each of those states and might not apply in other situations. And that's when we had to go for the next refinement, where we said that we need to potentially abstract out a little bit and get sort of validation from stakeholders across different settings. So that was the kind of flow that we went through.
Yeah.
Yeah.
It's a lot, isn't it? It's a lot to hold and a lot of justifications to make as you go along over what what you're doing and why and how. Samantha has a question in the chat, and Samantha is doing a PhD as well, and again quite an ambitious one. Samantha, I don't know if you want to come on. I know it's getting quite late now, but it's not specific. The question it's not specific to the realist evaluation, but she wants to know if you'd done a policy analysis before you started. I suppose it's about tapping into what Eunice was talking about, which is what about your prior knowledge and experience. But Samantha, I don't know if you just want to share a little bit about the PhD that you're doing over in New Zealand, because it's really interesting.
Yeah, thank you, Joe. I hope you can hear me.
Yeah,
Thank
I
you.
can hear you well, yeah.
Yeah, Pragati, that's an amazing work. Yeah, I can't imagine it's a PhD, right?
I know.
So, a lot, Joe. I don't know. Yeah, I don't have words to express. It's amazing work. But yeah, let me to tell what I'm doing is actually I'm also doing a policy analysis, so which is called individualized funding in New Zealand. So this is my third year, and I'm using realist evaluation the approach. Why I ask this question is because the before the realist evaluation, I'm doing policy analysis first because I wanted to exactly not exactly, but I wanted to understand the holistic approach, how the government brought this policy. So that helps me a lot to think about realist evaluation. So I use the Carol, which is what problem represented to be the framework. So that helps me a lot to deep dive with this, especially with this the realist evaluation approach. So that's why I wanted to ask that have you done because especially the in my case I am happy to share because the way that they have problematized the issue helps a lot for me to theorize the my approach. Yeah.
Yes. Great, great. Thanks
Yeah,
for sharing.
that's really
Yeah.
interesting.
Yeah. So in my case, yeah, I think, I mean, prior to this synthesis, there was a lot of on-ground actual implementation work that had followed, and policy analysis, mainly using frameworks like health in all policies approach. So looking at government policies across India from different sectors, how do they see health? Within each of these sectors. So that was kind of a framing that we had used. And this looked at 14 government sectors, right, from agriculture to food processing to others. And this was related to non-communicable diseases in the broader framing. That was one of the instances, and a lot of work on tobacco policy itself at the India and FCTC, the global convention level. But I had not dive deep into many other country policies per se. So through the synthesis, that gave me the access and the understanding of looking at how different countries have formulated or problematized the same issues, the same things on public smoking, but how have they gone about it? In some places, it was more about penalties. In some places, it was more about making spaces more safer in a way. And in some places, the regulation was very strong. In some places, regulations was very weak. So yeah, that was the kind of insight that I got through the synthesis. But before that, a bit on tobacco, NCDs, and those sort of policy analysis had been part of those. Yeah.
Okay. Is that all right, Samantha? Does that help?
Yeah. Yeah, thank you, Pragati. And one more thing that because now these policies, because we all are in the neoliberal, I think that the India as well, neoliberal, the economists, right? So we are running these policies in that, and then of course that I believe that when we are implementing these policies, one party get win and the other will lose, right? So how Pragati, how you have seen that? So who was the winner? Who are the losers?
Yes. So I think in tobacco control, this was a little beyond just say black and white, where there were clear winners or clear people to lose. But yes, definitely it was the industry who was a lot impacted, and hence a lot of mechanisms you'll see around the tobacco industry interference and how they have manipulated or tried. But health is the one that held the portfolio and the onus of implementing these policies. And then to compare it with many other departments where the actual implementation had to happen, like in schools through the education department, like through the enforcement officers in the police department, in the transport department. So there were just too many of them. So there's no clear winner or loser, but the health had to lead it a lot. And we could see that the stewardship was lacking in many states. They were not able to have that sort of a convening power across other ministries of finance, transport, health, police, etc. So it was mainly centered around health and tobacco industry and many of these other allied actors that had clear roles within the policy. And they are articulated actually. Almost 21 agencies are authorized to implement some or the other provisions of the POTPA. So that just adds to a lot of the confusion that who is finally going to do it. Yes.
That helps.
Interesting. Thank you. Thank you,
Yeah, it's good,
Pragati.
isn't it? It's a fascinating piece of work. It really is. So what's next, Pragati?
Yes, I think we from that initial work, I think a lot of it was Prashant was also one of my mentors as part of the journey, and I think his realist work, which was really the first one in the region at that point in time, back in 16 or so, paved the way for future inquiry. So now Prashant and I, we sort of run this workshop, annual workshop series where a lot of realist enthusiasts within India especially join us. And we have a Indian realist network, sort of which my colleague Arushi also helps and supports run it. That is something that's brewing, and we're excited about it. And currently, we're also working on a realist evaluation, sort of it's titled the Realize Lab, which is my intermediate fellowship with the DBT Wellcome Trust India Alliance. And here the focus is on analyzing the non-communicable disease control policies. So from one risk factor of tobacco to now move towards 4, 5 risk factors. I think it's really expanded our scope of the study. So we are, yeah, in that space of understanding NCD policies across India. So that's
Fantastic.
happening.
Fantastic. Brilliant. Thank you. Thank you so much. We've only got a few minutes left. If anyone else wants to say something, come on, just dip butt in. Feel free. I also always stay on the end of these talks for a few minutes. So if anyone has any questions, doesn't have to be related to the talk, could just be related to a particular challenge that you're facing right now, I will hang on at the end and hopefully help answer them. I hate the thought of someone spending months and months and months deliberating something that I can potentially answer in 30 seconds. So if that feels like you, stay on. We can help you get to the bottom of your challenge. But yeah, once again, Pragati, thank you so much. Really, really fantastic. I really enjoyed listening to it. It did what I wanted it to do, which was help to bring the paper to life. So thank you so much. And I would encourage people to read the paper as well. There's a lot of methodological gold in the paper that I think people can take and use, especially around the methods and how they were conducted. So perfect. Thank you so much. And so once again, thank you very much. And thank you very much for everyone who's turned up. It's lovely to see you.
Thank
And if
you,
this is your first
Pragati.
one, come back.
Thank you. Thank you so much, Joe, for the opportunity. And I really enjoyed this discussion. So yeah, looking forward
Me too.
to engaging. Thank you.
Thank you.